So how many of you guys have been told after you injure yourself you should be R.I.C.E that injury? Well, I'm here to tell you why you shouldn't be and why that might be causing more harm than good. And also, stick around to the end. I'll tell you what you should be doing instead. Alright, so I'm here to talk about a topic that people are quite familiar with, but I'm here to put water on it. Actually, let's put some ice on it. Anyway, so that topic is what you should do after an acute injury. So let's say you sprained your ankle. Most commonly, people are familiar with the R.I.C.E protocol. So R.I.C.E. R.I.C.E stands for rest, ice, compression, and elevation. So that one's been popularized, I'm not sure how long, but it's been a while. Pretty easy to remember, and it makes a lot of sense in the beginning. So why R.I.C.E? Rest. Obviously, people think when you rest your ankle, you rest your injury, that it gets better. Icing, they think it helps with swelling or it helps with the pain, which we'll talk about in a second. C for compression. Compression is good for the swelling that you get after the injury, and elevation, again, good for swelling. So why is this controversial? So let's talk about the first one, rest. Resting, we hardly ever say that we want to rest completely, especially an injury. What we find that if you move your injury, obviously within tolerable ranges, because that's what promotes the healing process. So what we say rather than rest is more relative rest, I guess. So yeah, rest is not recommended as much as it used to be anymore. The next one, ice, originally thought to help with inflammation and swelling and pain. Now, of those three things, I guess the main thing that it really does help with is the pain. So it acts as an analgesic. And what I tell my patients is ice is great as a replacement to Tylenol or any kind of NSAID or such as Advils or aspirin and stuff like that pain medication. So it's a great way to reduce your pain using ice, but it actually doesn't really do much in terms of helping with the reduction of swelling. So many studies have shown that swelling does not actually decrease with use of ice. So why are we using it then? The other thing that ice is really affecting an injury is that it slows down the inflammation process. So why is that a bad thing? So you think about inflammation as a kind of natural process of the body to clear up the stuff that got injured. So damaged tissue, we have to clear that stuff up. We need to clear out the area to make room for new tissue to heal and promote growth in that area. So if we're putting ice on this area and we're slowing down that inflammatory process, we're actually doing ourselves, quote unquote, more harm than good, I guess. Now, the third thing we're looking at is compression. So C for compression. Compression is still good. Compression helps with reduction of swelling in the tissue. That's what really helps with promotion of movement. So a lot of the times after an injury, we see that there's a restriction to range of motion, and that does kind of reduce our potential for healing because we need to move our joints, we need to move our muscles in order for them to heal, and the swelling tends to restrict that. So compression in this case here helps to reduce that swelling. And if you look at, for some reason I remember this, but Kyle Lowry in the 2019, I believe it was, NBA championships where the Raptors won, he had a sprained finger. You can see the doctor on the side bench there, he wrapped his finger up in a shoelace. So what they're trying to do, reduce that swelling. Once you get that swelling to reducing the joint, reducing the tissue, that allows you to move the finger or your ankle or whichever body part is injured better. And because of that, the healing, she's laughing, she's throwing sand in the air here. The healing improves a lot better. So compression still has its place, and compression is really, really good for an acute injury. So last one, E for, to complete the R.I.C.E here, E for elevation. Again, really good for reduction in swelling, reduction in the fluid in the tissue, so that's really good still. So we still recommend elevation. So what do I recommend instead of R.I.C.E an injury? Simple, and a different acronym, PEACE, P-E-A-C-E. So what does PEACE stand for? P, protect the injury, so protect it from re-aggravation. So if you have a rolled ankle, obviously don't injure it again. You can brace it, you can tape it, protect it a little bit, especially in the initial phases. E, again, just like R.I.C.E in this case stands for elevation. We do want to help to reduce that swelling, and elevation does really help to draw that fluid out of the area of injury. So continue elevating. Avoiding analgesics. So what we mean by avoiding analgesics would be avoiding medications such as NSAIDs, so that, again, we don't want to be reducing the overall inflammatory process. Again, I spoke about why that's important for recovery, especially acutely in the beginning of the injury. So avoid anti-inflammatories. C, compression. Just like with R.I.C.E, we want to keep the area compressed to help reduce the fluid inside the joints and just inside the tissue. Again, why we want to do that is by reducing the fluid, we allow our joints and body part to move better, and that's really what helps recovery, is the movement and progressive loading of the tissue. So compression to help reduce the swelling would be really helpful. And that final E in piece would be to educate yourself. Educate why is the tissue injured? How did you injure it? How can you avoid having that same type of injury in the future? And understand what might help it. So it could be, I guess another E could be also exercise. So you do want to exercise the injured tissue. And for most injuries, most of my patients, I give them exercises right away. You don't want to avoid using the injured area for many reasons we'll get into in a future video. Well, I hope you guys found that insightful. A little bit of insight into why I don't believe R.I.C.E is the best protocol for an acute injury. So if you like that, hit that thumbs up for me, subscribe to this channel, and we'll try to post some more information about these types of topics, kind of educate you guys a little bit about rehab and recovery. So thanks a lot. Instead of R.I.C.E your injury, piece it.